This is LiveWell Talk on sports, injuries, and treatment. I'm Dr. Dustin Arnold, Chief Medical Officer at St. Luke's Hospital, Unity Point Health. Joining me today is Kris Sehr, the Senior Physical Therapist with St. Luke's Therapy Plus, also a certified athletic trainer, to discuss sports, injuries, treatment, prevention, and anything else that should come up. Welcome, Kris.
Thank you.
You also should start off that you're also an alumni of the Harvard of the Midwest, also known as Co-College. We've been Tallman with them recently. Yeah. So we just referred to it as the Harvard of the Midwest on the podcast. So it's that time of year, sports injuries. But let me back up. It's always that time of year. I mean, this is a all year long thing, not just as school starts. But what are the most common injuries that you see at Therapy Plus?
Depends on contact versus non-contact sport. There's a big difference. This time of year, we see with football and volleyball, ankle sprains, knee strains a lot. Non-contact injuries, swimming, gymnastics, tend to see more tendinitises, stress fractures, maybe with cross country. So depends on the sport, but yeah, it is kind of all year round.
Yeah. I think as we were starting before we started to record, that particularly teenagers are kind of impatient, and they want to get back into the fray as soon as the acute pain is gone. Could you kind of speak to overtraining, and even if it's a quote strain, the recovery process and how long it takes, or and it can be an estimate, but I think it's important to stress that it's not instantaneous.
No, teenagers do heal quickly, but you're absolutely right. They are impatient. A lot of times, especially if it's their first injury, they think it's the end of the world if they're going to have to miss a game. And I like to stress with them, missing a little bit of time may overall mean that you miss less time. Because if you get it healed completely and healed correctly to begin with, it's probably not going to come back and bug you later, versus getting back too soon can sometimes cause more long-term problems.
And what is there certain conditions or scenarios that make a student athlete or just athletes more susceptible?
One of the things that has changed over the course of my career is early specialization, or kids just playing one sport year round really increases your risk of injury. Years ago, you played volleyball during volleyball season, basketball, track,
Right.
and you didn't necessarily play those sports when it wasn't that season. And now we see a lot of soccer's kind of a year-round thing. Even basketball, kids are playing club and high school. So that really increases that risk if you're not changing sports.
Yeah, I think there's a really good softball pitcher that's not playing for school ball and just doing clubs. You're right. We both have kids that age, and the club scene is pretty big. That that goes into the next question, is the recovery and the over training for this, because I think the kids are just going all the time. On a average week, how much should an athlete? What is the optimal training schedule and rest cycle for an athlete?
The American Academy of Pediatrics recommends 1 to 2 days of rest per week and 1 to 2 months per year. And I definitely have seen overtraining injuries. And I would say a lot of your athletes between club and high school sports are probably not even taking a day a week, much less a month or two a year.
Yeah, as I said, my youngest daughter had an injury and she had to sit out 6 weeks, and you would have thought we canceled Christmas. Um, you know, and just constantly ask when she can get back into it, which you respect that. I think that's fun. Like you said, it's fun to treat those patients and interact with them, but it's also um, mind numbing at times how often they ask you to get back in the fray when they haven't done that. So the most common injuries, could you take us through for the most common injuries, what they are, and then talk about the old ice compression elevation, whether or not ice or heat?
Um, that's old, but still absolutely applicable. Always ice. We tell people ice for the first 72 hours. For the most part, for athletes, you're going to keep icing. If you're looking at a 6-week-old muscle strain, you might do some heat before you start activity. But ice is probably the easiest, biggest thing you can do to kind of prevent that injury from increasing in severity. The PRICE, so PRICE, protection, right, rest, ice, compression, elevation, still best protocol you can follow initially, and after getting that swelling down makes a big difference on an ankle sprain, knee strain.
What is the injury that's the most difficult to recover from?
Concussion, probably,
Yeah.
which can be a whole podcast of its own. A lot of the stuff we see is acute injuries, and so they resolve pretty quickly. You're talking 2 or 3 weeks. Once you get into an ACL tear, those are 6 to 9 months if you end up with surgery. So for the acute stuff, I'd say 3 to 4 weeks.
I guess I would, from my experience, not personally, but observationally, it seems like a hamstring injury, if it's not treated early on well and rest to recover, can be one that can just plague a player all season.
Absolutely. Those can be real finicky, and you can think that they're doing pretty well, and then you go back to sport and they're real prone to retweaking
Yeah,
hamstring
yeah.
strains.
That to me, that seems one. So if I'm a athletic trainer or a parent coach, uh, when should I send when should I send the player to the urgent care or the emergency room? With the exception of, let's just take concussions out of that because that should be a pretty low threshold to be having them evaluated. But when should I think that they need an X-ray or they need to be seen by a physician or care needs to be escalated?
If they can't weight bear on a leg, or if it's, a severe limp, probably an X-ray is a good idea. Also depends a little if there was like a specific blow, a specific trauma. If a football player lands on somebody else's ankle in a weird position, that probably warrants an X-ray. Um, General soreness where there wasn't like a really specific trauma, you could ice for a day or two. If it's not getting better, like I said, for the most part, kids heal pretty quick. So after a couple days, if it's not improving, probably warrants a trip. I think it makes a little difference too if the school has an athletic trainer or a qualified person to evaluate it. That's helpful too, because then they can make that call.
I see being the team physician for or the Harvard of the Midwest, um, that I see more concussions from soccer players than I do football players. Now, part of that might be reporting them or just the lack of protection that a soccer player has, and it's a fairly physical sport, but I definitely see more soccer players with concussions.
I definitely see sports other than football. I think football's taken a little bit of a bad rap in the concussion game, partly with the NFL publicizing incidences that people have down the road.
Right.
Girls actually more commonly get concussions than boys if you look statistically. Um, I had a son that played 4 years of high school football and never got a concussion, daughter that played basketball and had 2. Um, so I have seen more in soccer. I had a cheerleader that had a concussion. So it can not be just football.
Yeah, absolutely. You had said earlier that concussions are probably one of the most difficult ones to recover because there's not a measurement, there's not a test you can run to say, okay, we're out of the clear. And I think over the years we've become appropriately more conservative in returning to play. What is the process following a concussion that you evaluate someone and make the decision that perhaps they are ready to return to play?
From the athletic training side, there's a lot of pretty specific layout. You need to be able to ride the exercise bike symptom-free before you progress to the next sport-specific drills. And then you need to be able to be headache-free 24 hours to progress back to practice. And then 24 hours being able to practice with no symptoms, which would be headache, sick to your stomach, sensitivity to light. And that gets to be some technical stuff because, as we touched on, kids don't necessarily want to be injured. If I'm looking at an ankle sprain, I can tell if it's black and blue, if it's swollen.
Right.
Concussions, there's nothing you can touch or visibly see. And those are tricky. Some of the things you're looking at with concussion symptoms, moodiness. Well, I had teenagers at home. How many times are they moody? There's some tough things like that. Is this from the concussion or is this just a typical teenager?
Yeah.
Sleepiness, again, some of that's not uncommon with teenagers.
Correct. That's so true. They have, I can't think of the name of the test, but they are trying to refine a blood test, kind of like a troponin for your heart, to signify if you've had some brain damage. So that wouldn't probably be a benefit in the short term, but that would be nice to have that test prior to returning.
Yes, it would for sure be nice to have something objective. There are some objective, again, dizziness, sensitivity to light. The impact test is short-term recall of letters or words, and then can you recall it 15 minutes later? So there's some stuff they can show the direction you're headed, but that's the one area I would definitely be conservative in.
I don't know about you, but my biggest fear always is that second impact. It's really not the first. It's not the concussion that happens. It's them returning to play and getting hit again very early after the first one.
Yes. Yes. And that soon can be 3 to 4 weeks before the brain is really fully recovered.
Right.
And I grew up old school where if you knew which side of the ball to line up on, you were going back in.
Right.
And that's challenging because I think that there's coaches and parents and teachers that's what they're familiar with. And when you tell a kid, 3 to 4 weeks before you're going to go back for contact, that doesn't usually go over real big. But certainly it's beneficial to be sure you're completely recovered.
Yeah, I think it's always tough because 3 to 4 weeks in an 8-9 week season is pretty disappointing to the parents and the patients, etc. So,
and 3 to 4 weeks to a teenager is a lifetime.
Absolutely, a weekend is a lifetime for a teenager. Last question: why did you choose physical therapy?
I actually got into it from kind of the sports end. My best friend had an ACL tear when we were freshmen in high school, and so I saw a little bit of it and thought it was pretty cool. And the more, then I got into athletic training when I was at Co and loved that side of it. So the sports medicine side is my professional love.
Well, just for full disclosure, Kris and I were at Co at the same time, and she was my athletic trainer for playing football. So we know she's good.
That should give me a lot of credibility.
That should, absolutely. Well, hey, Kris, thanks for taking time and joining me. This has been great information. Once again, this was Kris Sehr, senior physical therapist and certified athletic trainer at St. Luke's Therapy Plus. For more information, visit unitypoint.org.
Thank you for listening to LiveWell Talk On. If you enjoyed this episode, don't forget to subscribe, and if you want to spread the word, please give us a 5-star review and tell your family, friends, neighbors, strangers about our podcast. We're available on Apple Podcasts, Spotify, Pandora, or wherever you get your podcast. Until next time, be well.